Welcome, and to those on Zoom as well. Thank you for being here. I think we went up to 127 registrations on Zoom so far. So our first hybrid conference, it seems that we are getting people online. So this is, by the way, some of you thought I was kidding about the socks, but no, if you didn't get one, please do get one. This was a collaboration with Dr. Grom, Dr. Kenna, Dr. Schulert, a designer, Luciana, me, but we had a lot of fun with it. And the child giving out the socks is my son, Vikram. I just mentioned him because it is such a pleasure that I can bring him to the conference this time. Last time, I believe, he was in 2019, I believe, my husband was with him. He had a bout of MAS. He was in the hospital. And that has been our reality for many years. But for the last year or so, we've had a relatively normal life. And thanks to this community, thanks to many of the advancements that we will discuss. And we are all so grateful. And I know many of the parents who've been coming here are very grateful for the work this community has done. And we hope to continue that with the patient stories that we'll share a little bit later. Next slide. Oh, I have the control. Yes, yeah, I forgot. We have a tightly packed day, and I'll try to stay on time. And with that, I'll give it over to Dr. DeBenedetti for a few words.
So Rashmi asked me to say a few words, probably because I'm the oldest one in here. And I was actually here for the very first NextGen. I have to admit, I think the only European there at that time. And we really have become, you were there as well, Buzz? You're not as old as I am. Unfair. Anyway, Nikolai, you were there too. Some of us were there. And we have become a group of people who once in a while join together for something that is not a scientific meeting, is actually more than a scientific meeting. We like to take choices, sometimes we even make decisions. For example, last time we came up with the definition of refractory. Now we would say in a more modern language, difficult to treat systemic SJIA. Now we have to call it stills. But that's even better because we can have, adult patients in our cohorts, in our studies, in our discussions. The one thing I like, particularly, I think we all who have been here a few times have come to understand this is a very open meeting. Openness is the writing word. It's not only about data, it's about, opinions, sharing experiences. I think sharing experiences is an important word. We always have fun here. The discussion yesterday was pretty lively. It's pretty clear we have different experience, different opinions. That's exactly the goal of this, I would say the thread of the NextGen conference. With this, I don't have to welcome you. I think Rashmi and the Foundation has to welcome you. We look forward to a very productive and lively, sometimes heated meeting. That's be fine as well. And so we get it started, Rashmi.
Thank you. So just I'll walk over so that we have a very tight, especially the morning session, and we have a lot of people joining in on Zoom from many parts of the world. So we'll try to stick to the time. The people who are helping me run, Patricia is going to be there helping me keep time and telling me when it's time to end that particular talk session. Luciana is on Zoom, and Anna are going to be gathering any questions, and periodically we might bring up someone from Zoom who is asking a questions. More commonly, they will read out the questions. I've tried to have a mic runner in that part of the room, and I'll do it on this part of the room, but you're welcome to pitch in with that. I'm going to ask the speakers to try to stick to their times, even though it's hard, because we really want to have the discussion. That's kind of the point, is that we try to have discussion at every point. If you are asking a question, please give your name in the beginning, and then speak a little bit slow. In Zoom, etc., it's easier to stay tuned. And for those joining Zoom, it's the same as yesterday, so I won't go over that in terms of what the rules are. Later in the afternoon, we have some sessions, especially the BMT session, where several experts are joining in via Zoom, and then we might do something different with Zoom. This is the morning session. Quickly walk you over it. After this, we have the patient voice session, where we'll hear stories from a few parents. Then we have several talks on refractory SJIA from different parts of the world, and on some newer medications and about lung disease. And we go on to talking about unmet needs and a little bit about the background of clinical trials, and then on to a discussion of clinical trials and the challenges with clinical trials in SJIA and MAS. So that's kind of the plan for the morning, and then we'll pause for lunch. I'll go over this later. I try to stick to time rule myself. I'll quickly walk you, as we talk about refractory SJIA, we maintain our own contact registry, and I'll walk you over some of the very preliminary trends that we, Hani, where are you? She has been, oh, she's probably settling her kids right now. So she's been doing the analysis, and we're at the beginning of it, but wanted to show you one or two things that we think we are picking up. The contact registry is about 575 people, both kids and adult patients, and somehow or the other, in any of the surveys, anything we've done, it's always more girls. We really don't understand why that is the case, even though we hear from the doctors again and again that it's an equal division. I really don't understand what the reason is, but we pick that up again and again. And you can see the geographic breakdown. Just share these two tables, and this is about, we've divided these into patients diagnosed pre-2021 and patients diagnosed post-2021. And this is about their all-time usage of medications, which medications have they used. And you can see some interesting trends. Overall, it seems like maybe a little bit less oral steroids, about the same anakinra, maybe a little bit higher. Tocilizumab seems a little bit of a drop, but you can also see the beginnings of the usage of JAK inhibitors coming up, especially of tofacitinib. We have more details with this data, but I thought I'd just share some preliminary. In terms of symptoms, I think it's about the same in the two. The one thing that we started catching up is itching. You are seeing a lot more mentions of itching right now. And we also, by the way, Hani is here. She's done all this analysis, so thank her for that. But we kind of went and also grabbed from comments, et cetera, people who were mentioning itching. So with that, that's a very preliminary glimpse from our contact registry. We are happy to collaborate with doctors to help us refine our questions, and for us we've encountered some issues when we think that we need to do a better job of asking questions the right way. With that, on to the first session, which is the patient voices.